Dr. Scott Gottlieb is here, CNBC medical contributor, former commissioner of the Food and Drug Administration under President Trump. It must be so confusing for people, Dr. Gottlieb. We just get so many different mixed messages. And I'm wondering, is this the fall surge that we're seeing in the Midwest and Florida? And is this the one you've been talking about, or are we not there yet?
It could be. The answer is we don't know. It's really hard to make predictions out 3 weeks. We clearly have an expanding epidemic across the country in many parts of the country. Certainly in the Midwest, you're seeing cases go up in the South as well. And even here in the Northeast, you've seen a slight bump. Now, we expected cases to go up post-Labor Day because of the increased interactions after Labor Day, and we expect cases to go up in the fall and the winter. Whether or not this is a bump and we're going to see things start to level off, or this is a continuation of a broader trend and we're going to see cases surge heading into the fall and the winter, it's too early to say. I think there's a lot of risk that we're going to see significant growth in cases, though, as we head into the winter. This is a respiratory pathogen that would typically circulate in the fall and the winter. There's a large component of the population that haven't had it, and so there's a lot of vulnerable people out there left to be infected by this.
Looking for the silver lining, though, the death rates are not nearly as high as they were back in the spring. And I'm just wondering, is that because we're a lot better at it, which we are, or is it because death rates are still a lagging indicator? Do we know?
We're a lot better at it. Death rates are a lagging indicator, but we're a lot better at treating this. In-hospital mortality probably has been cut in half if you look at what's happening in the hospitals, if you look at what happened when we had the epidemic in the South. And that's a combination of better treatment, better approaches to care, and also some better therapeutics, the use of steroids in patients who are severely ill requiring oxygen, anticoagulation using blood thinners. A lot of patients were getting blood clots, and some were dying of those blood clots. Better approaches to care. We're not intubating patients as aggressively. We're using 100% non-rebreathers rather than intubating them. We're finding that improves outcomes in patients. There's a whole host of things that we're doing differently now that are improving outcomes. I think that we'll continue to make gains in reducing mortality against this disease. We're going to see the introduction probably of some therapeutics this fall and winter that could make a significant impact on outcomes for patients. And so it's improving. Yeah,
you mentioned therapeutics, but the president keeps talking about vaccines. He says they're coming soon, and then there'll be almost immediate distribution. Is that true?
Well, I think a vaccine, I'm on the board of Pfizer, which is one of the companies with the advanced vaccine development program. I think a vaccine is really a 2021 event. We might have a vaccine available for a select population here in 2020, probably older people, people who are in nursing homes, maybe frontline healthcare workers under a best-case scenario, if the data from these pivotal clinical trials that are underway right now shows that they're safe and effective. But the ability to have a vaccine widely available to the population is probably something that we'll see in the second quarter of 2021, probably later in the second quarter. But we may see some therapeutics come onto the market. There's been positive data from companies like Lilly and Regeneron around antibody-based drugs that could be effective against this disease for people who are hospitalized with it and at risk for bad outcomes. And so I think those therapeutics could come onto the market sometime this year, and they could be meaningful.
Well, that would be fantastic. One last thing, Doctor. College kids are back, and my old man, my dad, is not young. He lives in a college town, and he's like, those kids are going to go home and take it back to their older members of their family, and a month from now it's going to be ugly. How far off is he?
It's a risk. I think the colleges, a lot of them have in place testing programs, so they're going to test kids before they send them home. That should be helpful. And I think the reality is that once kids go home for fall break, they're not going to be able to come back. Probably they won't be back on college campuses until the spring, if you believe that we're likely to see cases continue to go up heading into the fall and the winter.
And you do?
I believe that. I think that it's going to be a difficult fall and the winter. We have one more cycle probably that we have to get through with this virus before we can start to get to the other side of this.
Dr. Gottlieb, thank you for the guidance. Appreciate it.
Shepard Smith here. Thanks for watching CNBC on YouTube.